Good day, ladies and gentlemen. Thank you so much for joining me on this other edition of the program You're in Your Health at an Equinoxe Radio Multimedia. Are you struggling, or do you know someone struggling with infertility? If your answer is yes, then know that today's program may likely be a solution to years of suffering or years of questions about your infertility issues. Have you ever heard about in vitro fertilization, equally known as IVF? It is a powerful tool that has helped millions of people around the world build their families. On today's edition of the program, we will look at the ins and outs of IVF and also tell you how it works. But before introducing our guest of the day, let me welcome my co-host, Esther Lucy Lengo. Good day, Lucy. It's a pleasure having you on the program today.
Good day, Immaculate, and good day to our listeners and viewers out there. It's equally a pleasure for me to be here.
And our guest for the day is a gynecologist and equally an obstetrician. He's known by the name Dr. Honore Imapi. Good day. It's a pleasure to have you on the program today.
Thank you. Good day, all of you. Good day to all our listeners.
Doctor, please, can you explain to us what IVF is all about and how it works?
IVF means that in vitro fertilization. Normally, the fecundation will happen inside the body of the woman, in the fallopian tube, in the last part of the fallopian tube, where the oocyst and the sperm will meet and make a gamete which will come back and sit inside the uterus to grow. But for certain reason, we will see during these different parts, it will not be possible to have the fecundation inside the fallopian tube. So they have to take all those cells, oocyst and sperm, and in the laboratory, they will join them and make an X. When they will put it at that moment, they will take it and put it inside the uterus of the woman. What is simple in vitro fertilization? The first part, it's inside a cup. You can say that inside a glass, but it's not really a glass, inside the laboratory.
Okay.
And the second part, it will grow inside the woman body normally, inside the uterus.
How does IVF differ from other fertility treatments, for example, the intrauterine insemination?
Well, there are many causes of infertility. You can be infection, it can be most of the time where the woman will come or the couple will come, we will take off those causes of infertility and we try to treat. For some part of that, we have a fecundation inside the woman. But for certain parts, it will not be possible. You talk about intrauterine insemination, what they call IUI, and in vitro fertilization. The difference is what? Most of the time, they will take a sperm and put inside the uterus, which will grow normally, which will work and go inside the last part of the tube, as I was telling you. But for this case, the tube should be okay. So all the processes is passing inside the woman body. Only apart that they have to select sperm and put inside the uterus. And so those sperm they'll go alone and meet the oocyst inside the last part of the fallopian tube. But for in vitro fertilization, the first part that I was saying, the first part will happen in the laboratory. There are big laboratory, special machine that would see, because they are small size, micro centimeters, I can say something like that.
Okay.
The first part will happen inside the laboratory, which they will collect the eggs that has been, they take the eggs and put inside the uterus. But for a
intrauterine fertilization.
Yes. They will take only the sperm, work in the laboratory, and now put it inside the uterus. It's a billion, most big quantity, which will grow alone, which will work alone, and go inside the tube and meet the eggs, and mix the oocysts.
Okay.
All right, before we come back to you, Doctor, these are the numbers for those who would like to ask their questions on the topic we are discussing today. 670-54-7049, 670-54-7049, or you can join us via 656-6222-22, 656-6222-22, as you can see on your screens. And back to you, Doctor, what are some of the main reasons why couples or individuals might opt for the IVF?
Most of the time, it's not the couple that will opt for it. Is the doctor have to say that now, at this moment, we have to go to IVF. Because they normally try to conceive themselves alone, but there's no success. They try another method and there's not success. So the first main reason is the fallopian tube. I told you that for intrauterine insemination, they have to take the sperm and put inside the uterus, which will go alone to meet a cell, to meet the oocyst inside the fallopian tube. But if fallopian tube are blocked, it will not be possible. You want to, this is the first reason. The fallopian tube is blocked. Maybe because of an infection, maybe because the patient has what you call ectopic pregnancy, several times, maybe 2 times. At that moment, they have to cut the fallopian tube. It's not be possible to sperm to meet the oocyst at that state, as I was telling you. At this moment, you do the in vitro fertilization. Okay. Another problem can be what they call endometriosis. Endometriosis is an infection of women who will induce inflammation, and it will not be easy to sperm to go meet the oocyst at the place I will tell you before. There was also what they call dysovulation. Some women will not ovulate normally. I don't know why. Because their ovary are not working normally, because there are many problems, so we have to go into the in vitro fertilization. There can be also a man problem, because the sperm of the one is low or is not a good quality or a good quantity. Because we have a child, we have an X, we need a quantity of sperm. They have many to have only one child. That's the problem. So when the match is not possible to give the quantity of sperm that we need, at that moment we choose for in vitro fertilization. And at that moment, it's a special kind of in vitro fertilization that we can choose. When the quantity is too low, they have to what they call XC. It means that they have to take the sperm and put it inside the oocyst at that moment. I talk about a tube. I talk about men fertilization or endometriosis. There can also be an inexplicated infertility. Sometimes we do all the tests, all the exams, they will not see anything. At that moment, we say, okay, maybe in vitro fertilization will be the best case. There are many reasons like that why women should go into in vitro fertilization.
Are there now some limitations when it concerns the IVF?
Limitation, maybe there's not really limitation concerning the woman, but when they start, they can try for some time before say that let us state first. But you can try in the center maybe 3 times. She will be discouraged, and after a year or 2, a certain time, you should say that I want to go again. I want to try again, maybe in another center, in another country. It's like that.
Doctor, we know IVF is not very common in Cameroon, and very few hospitals offer these services. What are some of the success rates of IVF at this point in time?
Normally, you have to say the success in normal fertilization. It's not too high. I have to tell you. Many women think that they have to make love with the husbands and they have a child. It's not like that. There are many times that you now have. I usually say to my patients that it's good like that. I'm not sure that there is space in this world again. So it's normally low. Now concerning this technique, is less than the normal fertilization. You can say in some big center you can have 50%, 40%. It depends. It depends of the age. It depends of the sickness. It depends of many things. But women should know that it's not 100%, because when they say that I want to go to IVF, they think that because they told them that they have to take a sperm and mix with the ovary, it means that automatically it should be a baby. No, it's not like that. It's not like that. You have to know that this issue is the issues of God. I have to say that it's only God. I have to say that it will be a success or not. So of the time we try, we do our best. We said, I'm sure we have a pregnancy here. At least there's no pregnancy. And why? Because sometimes the uterus is not really at the moment to keep the baby, and we are still trying to know to check why you do the best team, you do the select really, but at the end you don't have a baby. You try to increase the level of the success of in vitro fertilization.
So on a scale of 10, about how many are successful in Cameroon?
I will say that it depends of the age. You people should know that most of the time women came when it is late.
Mm-hmm.
You have to know that when the woman has been born, the number of cysts is fixed, and each cycle should be reduced. It should be reduced. Many women used to come at 40, 45, or 50 before for IVF. The result is very bad at that moment. But when they start, maybe it is 25-year-olds, the result is good. At that moment, it can be 40%, something like that, 40, 50%. But when you came late, it should be 10% in another center.
Okay. And how many IVF cycles are typically recommended before considering other options?
3.
Okay.
3, yes. But I want to tell you that women will not follow. They will not follow. You say, I need my child when she has depression, she's on stress. When she has she'll try again to another place.
Okay.
All right, doctor, let's talk about the potential risks that are available when it concerns the IVF. Are there some risk factors
Complications?
or complications?
Yes, you cannot say that there's not a risk. There's any risk for anything that we have to do. Even the living is a risk. Even working, go to that service, there's a risk. A risk is, you can say what we say, upper stimulation. When we do the stimulation, because they give a drugs and the patient reacts on excess, you expect to have a normal reaction, but they react on. So they have the upper reaction, and they can have some sickness. You have to control it. You know how to control it. You have to do the echography. You know that maybe they can have another reaction here. During the process, sometimes we have to do the general anesthesia when we have to do the function of oocyst. They have the risk of anesthesia. You can have the risk of anesthesia, so they have to check the patient to be sure that the anesthesia they will give her is the good she needs really an anesthesia. They can have the risk of those drugs, those as hormone, and women can take the drugs and they will take weight. She will be fat more than she was before. Though there are some certain risks that the patient can have when they take the drugs. Another risk, and second effect is depression of the process, because if you take time, you've called it at any moment, and at the end you have lost all your time, or lost all your money, and there's no success, you can have depression. Though people should be prepared.
You talked about money, Lucy. Would you like to know about the cost?
I would like to know about the cost, doctor. Let us know about the cost
How much
of
does it
IVF
cost?
in Cameroon.
It's really cost. It really costs. Is in the level of Cameroon, many people in Cameroon is really cost, but the charge do not have a price.
Of
That
course.
woman we
Really?
used to say they don't have,
Really?
have a charge, but
Yeah.
really is cost.
That's cost is how much?
Approximately.
How much?
How much are we talking
more
about?
than million, I have to say, because there are drugs. There are drugs that process that minute in, and those drugs are really expensive. That's the problem. Drugs are really expensive.
Okay. Thank you so much, Doctor, for accepting our invitation tonight.
Thank you.
Thank you to Lucy for
Always
being part
a
of the
pleasure,
program.
Immaculate.
And we equally thank you all for taking part on tonight's edition of the program You're in Your Health at Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. I received technical assistance from Luis Pego and Jonathan Babula. Have a wonderful day in the company of interesting programs on Equinoxe Radio and, of course, television. Bye-bye for now.